Welcome, everybody, to Edgar Casey, Arizona's continuing series of, in this case, interviews. We're lucky enough today to have one of our regular speakers, Nurse Dora, who worked since 2020 in a COVID wing of a hospital. And I am focusing my questions with Dora today as far as what her experiences were with people passing on not only from that disease, but just in general. So, first of all, Nurse Dora, welcome. And I wanted to start with a question that you've witnessed well over 100 deaths in your career. And I wanted you to start by telling us of one that had to do with COVID that really stood out to you the most. And why did it stand out to you?
Okay, so one of the best memories I have of a patient that was dying, not that I took joy in watching that, but it was during the height of COVID and where we had many deaths, and there was this female. She was in her mid 80s and very peaceful person. You can tell that she was very spiritual in all her actions as she, expressed her gratitude for anything that we did to help her. So she was on very high oxygen, and her needs kept going up. She was placed on a BiPAP machine, which is where this machine that helps you breathe, and that's pretty much the time before you have to go into getting intubated. Well, she had already had decided that she would not be intubated, that she just wanted to be let go of, and just be made basically comfort care where we just make them comfortable. She lived with her daughter before she was hospitalized, so the daughter and her had both decided that it was time for her to go. And so I was, like I said, the one caring for her on that day. So we took her off the oxygen. Right after that, we FaceTimed. She FaceTimed with her daughter. That's all we could do at that time because there was no visitors allowed, obviously. So she had a conversation with her, and I witnessed it. And it was the most loving conversation, end of life, that I've ever seen. The daughter expressed her gratitude for everything she had done for her, raising her, being such a good patient mother, and giving her many thanks for spending the last few years living with her, and reassuring her that everything would be okay, and that she just it was okay for her to let go. And the patient also expressed all her gratitude towards the daughter for helping her through the end of her life and for being there for her. And they just both expressed how much they loved each other. It was really hard to hold back tears watching that, and just feeling the love between these two women, just feeling the strong connection they both had. And so, she hung up, and the patient died peacefully within the next hour. So she just, what that looked like to me, like they were both like she was ready, the patient was ready, she had made her peace. She had very strong beliefs from everything I had seen with her. And so that was, to me, what that taught me was just that's how I would want to go if I ever, whenever I go, that would be the best way to go. It was a beautiful death. And that's the memory that I hold on to, is how beautiful that was and how much peace there was. And even before that, caring for that patient, you could see the light in her eyes. There was a special light coming out of her eyes that's just comforting to others. And she was just such a memorable patient. So that memory I'll hold on to forever.
How long after the COVID quarantine started, call it April of 2020, did that take place?
That probably was the end of, that was about towards the end of 2020.
Okay. So
Yeah.
you'd been able to have a number of them come through at that point to
Yes.
be able to compare it to.
Mm-hmm.
Well, no doubt there's the other end of the spectrum, but
Yeah.
where it didn't go well for the patient or the family. So if they didn't really take it so well, why don't you explain
Yeah.
what you remember from that?
Yeah. So it was a male patient, late 70s, as I recall. And he was very strong personality. He had several children in his life, and they called every day to check on him. But they were all very persistent that he was going to live. As was the patient. The patient said, "I'm not dying. I want everything done for me. So whatever it takes, we got to do it because I'm not going to die. I'm not." He just was not ready to die, and the family was also very persistent that we do everything for him possible to keep him alive, which meant, included intubation. And so there was one day where the family decided that it was, well, actually the patient went more lethargic. He wasn't being responsive anymore. He wasn't talking anymore. So at that time, we would FaceTime with the family and, they could see them. They tried to talk to him. There was no responses anymore. So the family then decided that they were going to have to let him go. And that was really hard for them to do because they had, insisted that we do everything for him and we honor, their wishes. So um, at that time we had to, they said we're going to go ahead and let him go. I mean, he's not responding anymore and he's fought so hard that we're just going to decide to let him go. So we, at that point, took him off of oxygen. We weaned him off of oxygen. You just can't take people off. So we weaned him off and made him comfortable. So towards the end of my shift, I remember he was still on a little bit of oxygen, but his oxygen saturations were dropping where they're not compatible with life anymore. And so but that took the rest of the day. Towards the end of my shift, I gave the report to the oncoming nurse, and he's still struggling, and we're still making him comfortable. But he's still very anxious, so you have to just kind of keep monitoring vitals and everything to make sure that that they're comfortable. So I went home the next day. I come back, and I thought, overnight, well, he's probably, he'll probably have died during the night time. So I come back the next day, and he's still struggling, but like I said, we make him comfortable. He's, the oxygen is now down to almost nothing, and he's still, his vitals are still there. All signs of life are still there, and so this went on through all day, and I keep going back to check on him, and he's still, he's still alive. Probably towards the end of my shift, I said, I can't believe this man's still holding on. The family would call and they, try to reassure him, try to comfort him, just telling him to let go and it's okay. And, just thanking him for being such a strong father in their life. And so he's still living, he still lives. So then that evening I thought that I can't believe he's still alive. So again, I go home, I come back the next day and he's still alive. And so a couple more times I check on him. The second time I come in to check on him, he's now his pulses are barely there. His oxygen is dropped to like very, very low. So I think, okay, well, this is it. So the next time I come check on him, there's no more pulses detectable. And so I had to bring in a second nurse to witness that death. And then after that, you notify the doctor. So the nurse comes in. Yeah, we both confirmed that there's no more pulses. So then I go back out there to notify the doctor. Meanwhile, I come back and try to, come back into his room and do a last check on him. And I detect pulses again. I see his oxygen saturations come up. I mean, still not compatible with life, but they're still up. And I just, that was like shocking to me that he had come back again and was just continuing fighting for his life. So again, I leave the room, I come back again. Well, this time he's really gone and there's no more, pulses detectable, no more blood pressure or oxygen saturation. So that was it. And so that to me, I guess the main message that I got from that, when you're not prepared to die and when you're going to fight all the way, you're going to have a really hard time leaving, and it's going to be prolonged. But overall, from the deaths that I've seen, even non-COVID, that's kind of the picture you see when someone's like not prepared to go. It's going to take a long time for them to leave.
When you were talking about both ends of the spectrum and the stories representative of each, I noticed that you had references to people sharing a spiritual outlook on life. I didn't hear you bring that up this time.
Yes.
There wasn't.
There wasn't really. I never really heard anything about that. A lot of times you get people request like a chaplain or phone call. Like I said, at the time, that's all we can do, but there was never any references about it, nothing at all.
Now, of all the people that you've cared for, whether it was COVID or not,
Mhm.
but they were, kind of on death's door, so to speak, did you ever hear any of them mention reincarnation?
Um, Actually, no, I never heard any of them
Yeah,
mention his
and
name.
it's not that they wouldn't talk about it with their family, but they may not
Yeah.
talk about it with their nurse.
Yeah,
Like,
yeah.
I could certainly understand that. Just as an aside, when my father passed away, he passed at home, and one of the things that really I hadn't been together, I wasn't married yet. My wife and
Mhm,
I were just dating, and she said I was particularly impressed not only with how the family took his passing because he just died in his sleep. We had no idea it was coming, but that we were speaking very plainly about what happens after you die
mhm.
in reincarnation. I wonder when he'll come back and what will be the opportunities and that sort of thing. And she's going, you guys really believe this stuff.
Yeah, yeah. It's,
Because you're pretty sure that when that kind of an event takes place,
mhm.
all of the rest of it just goes aside, and you really talk about what's in here and what's in here. You probably let's go for one more. We've talked about just COVID cases,
Yeah.
but I'm sure out of all of the deaths that you've seen and witnessed, one really sticks out above the other. So why don't you tell me about whatever comes to mind there?
Yeah, there was one recently that I experienced, and it was a male in his early 60s who was dying of well, he had been diagnosed with very aggressive cancer probably within months of his death, and so he would come into the hospital every now and then, and so I kind of when he was admitted the last time when he died, I recognized him, and then and the actually the family also remembered me, and so then his wife was there, and I came in that morning and I looked at him and I said, "Oh my gosh, he's really not doing well. He looks just really pale. He's really just his breathing almost looks like it's agonal breathing, which is near when you're near death." And
Yeah,
so and I can also sense that the wife knew it, even though, he was getting really aggressive chemotherapy. She kind of knew, and she came out of the room to ask me um, kind of frantically, and she asked if I thought he looked like he was dying, or if I thought he might like death might be imminent. And I said, well, just looking at him and looking at just his breathing and just going over what's been going on since he was last hospitalized, he just doesn't look good anymore to me. And then but it's almost like she felt that he was dying already, and like so, and that's why she came out to ask me about it. And then she also asked to have the doctor come see her because she wanted to they wanted to the patient, and the wife also wanted to talk to him about making him do not resuscitate or intubate, which to me felt like they had already talked about all of death and what's going to happen when he's near death. So the hospitals came to see them, they changed him, and then she also asked if she should call her kids, and so that they can come by and see him because they all live in very close to the hospital. And so I said, I think it's a good idea. I don't know when he's going to die, but I think it's a good idea to be surrounded by family when you're just struggling like like he is right now. And so and she did that. So in the morning, the patient was very alert still. He was still able to talk with a lot of effort, but he was still talking, and we were still trying to make him, give him whatever he needed to make him comfortable. So then probably about midday, he started to lose consciousness. He was not responding anymore. And so then there was one more son that he was waiting for that probably was, I don't know where he was at, but he was on his way to the hospital. So we took vitals during that, I don't know, probably after 12, we took another set of vitals and his blood pressure had dropped significantly from his last one. So then, so the family could see that he was just declining. He's not, again, not responding. His breathing is getting very difficult. And so then go back in the room. The son had just gotten there, maybe like another 2 hours after that son arrived finally. So we go back in and I told them, I kind of explained what they can expect to see. And because at that time he was clearly dying and they knew it, the whole family knew it. And so the son comes in and I give him privacy with the patient. And then within a few minutes, he comes out and he says, I think you need to go check on my dad. And I said, oh, but what does it look like? He's like, I don't know. I don't think he's breathing anymore. So I go back in. Well, he had died. And it's almost like he was waiting for the son, but which you hear over and over again. And yeah, he went peacefully. His family, I think, was the difference with this family was that they thought that he was still had a chance with the chemotherapy he was getting, and I think the patient thought that too. But the patient was also someone that knew that when it was time to go, he was going to go, and he told his family, respect my wishes. I don't want to be intubated. I don't want aggressive measures taken. So please just let me go. And it was so beautiful to see the family coming together and the family comforting him and the family thanking him for the great father that he had been to them, to the grandchildren, and what a good husband he had been to them. And so that was just so beautiful to see. And I don't even know how other way to just explain the way that death went, but it's just comforting. And um, where the family and in the even when they first brought him in, thought that he was going to be okay and he was going to continue on with chemotherapy, but they were able to just like realize and live in the moment, knowing that this is it, this is the time that we got to let go, and we got to just be there to comfort him and to make just to make it as reassure him as much as possible, which they did, and that was it.
You mentioned that it seemed like he was hanging on until the remaining son was
Yeah.
able to get there and join him. Uh,
Mm-hmm.
uh, I know that you don't have any background with these people, the patients and the families beforehand, but just to share on my own side of the world, when my mother passed, she was diagnosed with acute leukemia, and just her white blood cell count
Mm-hmm.
was off the charts. And the doctor said that she probably had 4 to 6 weeks to live,
Well,
and that it was not a painful death, but that she'd just keep losing energy as it went. And it turned out that she had enough time in order for everybody that she had ever known to either call in
yeah.
or drive in. Some people drove to Phoenix from California, where she spent most of her time, to be able to come in and say goodbye.
Mm-hmm.
And as soon as everybody had come in, she passed, shortly thereafter. I have seen enough of this in my own life that it looks like the better life you live, the more control you have over the way
Yeah.
you go.
Yes.
That you can hang in there as long as you want to, in order
Mm-hmm.
to. It's not that you're not going, but you have
Mm-hmm.
enough say of going. By golly, I want to be here when when that remaining son is able to get here. So
Yes.
just in closing, if you can kind of bullet point it for us, nobody gets out of this life alive, but we are eternal souls. And
Yes.
if you can consolidate it into two or three things that you would recommend to be able to make it as easy on yourself and on your family as possible.
So we're talking overall on what to do before death, or just overall the lessons that I've taken from this.
Both. I like that.
Okay. So for me, watching those deaths and many others, but these are the ones that really stood out to me, of how some people are just, they accept that they're leaving and then they go peacefully, or fighting till the end. For me, it just taught me that first of all, you have to learn to forgive, and you have to make sure that you don't leave. Um, I guess maybe don't like have really good family relationships, and if you have any issues with people, make sure you resolve them. I'm not saying overnight, because there's some that are pretty difficult for us, but we have to let them go. And we have to take ownership of our life and not let people, not blame others for all of our actions, because the way I see it, any experience, whether good or bad, is just lessons for us. So learn the lesson and let go, and forgive others, and be present in your life, and be authentic with yourself, be honest with yourself about what you want in your life and what you don't want in your life. And let's see here, I guess that's pretty much it. I guess you also have to think about when the time comes for you, whether other than having a traumatic death, or an accidental death, and those don't count, but I mean, you have to also like start thinking about, what do I want done for myself if I ever get to that point where maybe I get like I don't know, I'm close to death, and what do I want for myself? And then you have to talk to your family about it, talk to them, because if you don't talk to them, they're going to just when the time comes, when they're very emotional, that's not the time that they're probably going to make the best choices for anyone. And besides that, then they're going to try to guess what you would want. If you're very like if you tell people what you want, then they're gonna know. Like right now, my mom's in her late 70s, and then like a lot of Hispanic people are afraid to talk about death. They're really afraid of death because I mean, my mom says, she's so afraid that she might go to hell. And then even though I try to reassure her, but she doesn't really go for my beliefs at all. She thinks that you die, you go to hell or you go to heaven. And so I try to share my views with her, but just talking to her about it and asking her what would you want done then, at the end of your life, like what do you want done? Do you want to be buried? Do you those little simple things can make a big difference in even honoring her wishes. Yeah, so just letting people know what you want done at the end of your life. And I
Yeah.
don't, it doesn't matter how old you are. As an adult, of course, you have to, talk about it and say, well, this is what I want done. Just communicating your wishes and don't leave it up to people, to make those decisions when they're, under a lot of stress
All right.
and pressure.
Well,
Hmm.
I thank you so much, Nurse Dora. That says, actually, for me, I was learning a lot of stuff there as you were going through all that, especially when it is how, we don't have to like each other, but when it comes to
No,
family, it really helps if we love each
yeah.
other,
I
and
think,
that forgiveness really takes you there.
yeah, and I forget that I had a grandmother, my maternal grandmother, who was a very strong woman. She was ahead of her time. She actually chose to she had a plan for her death. She when that time came, which I thought, I didn't believe that she was dying, but she said it's my time to go, and she was actually not even, she was actually healthy overall. She had had a couple of strokes before that, but she was still able to walk and talk. I mean, forgetful, but I mean, she was in her mid 80s. But I remember when she said, I'm gonna die. I want you to just, because she ended up in the hospital for, I don't even remember what, but probably, I don't even remember. But anyway, they discharged her to hospice, and then I talked to the doctor. I said, "Wait a minute, why is she being sent to hospice?" And he says, "But that's her wishes. She wants to go to hospice, and so we're going to honor it." And so she went to hospice, and then at that time she says, "I want mariachis, and I want to have someone read me the Bible. I want someone to sit by my bed and read the Bible with me." And then I want, so we all joined, and that room was like, I mean, there must have been like 20 some people, and they're pouring out into the hallways. And so I remember her saying, "Well, can I have a drink of beer?" And then they all looked at me like I'm the judge. And I said, "Oh my God, give her a drink of beer. She wants a drink of beer."
What's it
So,
going to
so
do? Kill her?
yeah, so she took a little tiny, like a little teaspoon of beer. And then they asked her, "What would you like to be?" Well, people don't really want to eat when they're dying, but she said, "Well, bring me my favorite soup," which was one of her favorite soups. So they brought her a soup, and she ate like a little teaspoonful. And so, and then they brought the mariachis, and hospice was so like gracious to allow them, and they played some music, and then she was so happy. The whole family's happy, but my grandmother was a very private person, and so they were, the whole family surrounding her. And then even then I would say maybe she wants time to herself. Maybe we should all leave and give her some private time. So she actually died, I believe, in 24 hours, and she died. I thought that was a beautiful death, and that's about, gosh, probably about, she died in the 1990s, late 1990s. So
Okay.
to me, that was one of the first. She was an example to me of how to die, and she
Uh,
actually lived her life bravely. She was very outgoing and very. She was not someone that shut her mouth for anything. She spoke her mind all the time. And so she died a beautiful death. And I think that's one of the first examples of me, but I wasn't ready for that. I wasn't even, I thought, how can you be dying, Grandma? You're still fine. But she says, no, I'm going to die. And in fact, she was such a private person that when hospice staff told the family to just give her some private time, and that's when she died by
okay.
herself.
Well,
Yeah.
sounds like we both had people in our family that set a pretty good example about how to
Oh,
go.
yeah, she was.
All right. Well, once again, we thank you, Nurse Dora, for being able to share your personal insights on this all important
Mhm.
subject that we all eventually get to deal with. My own take on the end is to look. It's hard to do this, but to look forward to what is next in the
Yeah,
eternal adventure of life. And if you can look forward to it, then you are open to it when you pass over to the other side of having a good
yeah,
experience instead of expecting a bad one.
yes, exactly. I
This has
agree.
been Nurse Dora and John Schroeder for Edgar Casey, Arizona.